the whole process itself is very, very difficult. The amount of shots, the amount of learning, you become a nurse for yourself immediately. We decided, you know what, just in case anything were to also go wrong, maybe in our relationship or anything like that, you know, these are my eggs. And because we weren't married yet, for me, right away, it was, okay, well, you're stage 4. I'm like, what? I didn't have any symptoms other than this cough. But, you know, now learning my lung was, you know, completely infected, and, you know, that was all the cause for it. So yeah, stage 4. And then you know, we wanted to do family planning. She knew I was getting married. And she knew that was, actually, she made it seem more important to me than I think I really realized. And, you know, she explained it where the drugs that we'd probably go with could impact my my fertility, but it's not guaranteed. But she did say, like, she felt that it would be important for me to take the time and do that. Sometimes patients don't have that time, and she did say, you know, you do have that time. I will give you that time to do it. So, you know, we think it's probably best to do so. And I do think that was something that at the time, going through the whole process of, you know, freezing my eggs, I do think, to me, that was like a huge inconvenience, because I just wanted to get better and then have a wedding, you know? So I knew every day counted, because my hair, whatever it was going to be, need to grow. So he said, the faster I'm done, the faster it will grow. So that was hard at the time to do so. So I took the month basically to do the egg harvesting, because I went to the first doctor that she'd recommended. They do the egg retrieval in office. And although it is local anesthesia, they weren't comfortable with where my mass was in my chest, with, you know, being able to breathe properly. They just didn't think they had the proper facility to do that procedure for me. So that was like a week and a half-ish with that first doctor before she confirmed that I should go to a doctor in Manhattan at Cornell to do it, because they do the procedure in a hospital. So, you know, but then, you know, once we started with the shots and did everything like that, it was a quick 10 days. And then, you know, I did the egg retrieval, I think, on a Thursday. That Friday, I did my first round of chemo, well, immunotherapy, and then rolled right into chemo. So it was the end of July 20 something was when I first started the chemo treatments. That was where we were learning a lot, because again, we knew about lymphoma, we knew how to do cancer. We didn't know about this. So this was something that, yes, you know, we did together, because my mom's like, I'll handle the cancer part. This is your family. So, you know, we knew we were going to do it, especially after the strong recommendation from my oncologist. And I think the one thing that we did discuss was about, you know, eggs versus embryos. I think that's something that, you know, anyone entering that that world of health that'll be like one of the first questions that you're probably asked, or something that you learn. And we decided the eggs, then that's the way I decided to go, is just freezing your own. So you're that's like the first step of IVF, if I I'm explaining it correctly, where you're producing as many eggs as possible to retrieve all in one. So that's the first step of it. And then with the embryos, that's when you mix in, the sperm, then that you could freeze as well. I believe there are some benefits to going and freezing the embryos itself. I think there's perhaps a higher success rate if you do need to go then use those embryos. But we discussed it and we decided that just freezing the eggs was what we wanted to do at the time. I think there was like some extra, again, time that needed in order to do the embryo freezing, but we decided, just in case anything were to also go wrong, maybe in our relationship or anything like that, these are my eggs. And because we weren't married yet, even though, yes, we were about to be, that was something that I said, these are mine. And, we will eventually, if we need them, fine. But, that was something that, he said, absolutely, this is it. Like, this is the decision that we want to go with. And, just a lot of learning in that time. That was the hardest part, I think, of the last couple of years for me. And again, I know that I was in a very different circumstance than most of the people that are in that are in those clinics or in those waiting rooms, and I fully recognize that too. For me, I saw this as somewhat of an inconvenience because I had a bigger, fish to fry in a way. But, now looking back on it, it's completely different because, now maybe in that stage next where, you don't know what's going on. So the process, and especially because I had to go to 2 doctors, and again, that was time that it took to get through all those appointments. Again, that was more of the inconvenience for me. However, the whole process itself is very, very difficult. The amount of shots, the amount of learning, you become a nurse for yourself immediately. I'm an economics major. I didn't do, I was okay in chemistry. But each shot is, number one, the money. Oh my gosh. And I'm very fortunate where I was, a beneficiary of programs that helped me with paying for those medications. But if you're doing that, because you're not a cancer patient and you're doing it because you want to start a family, I cannot imagine, how people pay for this in multiple cycles. So, the stress of keeping your needles clean and again, becoming a nurse overnight is absolutely insane. And learning the exact dosages and cleaning everything, crazy. The one shot, I think it's Menopur, that one burns so badly. And, again, I'm a person who doesn't mind needles, but getting stuck every single day, and then them drawing blood for you in the morning like the vampire, I was getting tired of the needles and I would cry, or I would try to hide my crying, but I was laying down on the couch and just that Menopur shot would just send you over. And that's what was hard because they knew they had to stick me 2 more times that night, but at crying, you don't want to do that to somebody. So again, for me, it was like, I'm more crying because I don't want them to feel bad. But they do because, they're inflicting pain on me. But, again, in hindsight, yes, probably the best thing that we could have done to ensure, hopefully a family going forward, whether we have to use them or not, it's good to know that we had them. How did I get through it? I think I just had the mentality like, this is what you have to do. This, while it's not the cure for what you're actually sick with, you have to do it because this is your future. Right. And I think at that time I had gone back to work from basically after I was admitted from the hospital and had my initial diagnosis. I was off a few days or maybe a week or 2 to start the whole cancer process and appointments. But then I did go back to work for a few weeks before I officially started treatment. So I was just in sort of a mode at that point, like, okay, morning monitoring, it's very early in the morning, got back to my house, then started work, did all these things, had dinner, do the shots. So it was kind of like I kept that routine pretty consistent and just added in when I had doctor's appointments. And I think that helped me just kind of keep focus and remain distracted in a way, which sounds like an oxymoron, but I think it kept focus on my routine, but also, distraction from these bigger things that was happening. So yeah, I mean, I think that's just how my brain is wired at this moment. I think that's sort of this time now where I'm just reflecting and saying, like, okay, you just went through something pretty massive and you have to take some time and reflect in that. And I mentioned before too, I did work through all my treatments. When I wasn't in the hospital, I came home for a couple days and took some rest, but then I did work when I could work. I mentioned I should have gotten married originally April 2021. We moved it because of the pandemic. And then when I was diagnosed, like, obviously to me, that was like the last thing that I needed. I was like, we will see what happens. And I knew that there was going to be, my oncologist had said after my treatment plan was 6 cycles, she said after 3, she would expect remission. So at that halfway point was basically up until that halfway point, didn't think about the wedding very much other than my hair. So I was just kind of like, we're not talking about it. We're not at this point, it's not really happening, but we haven't canceled anything. I don't even think we told our vendors anything yet. It was just, or I think we did say our vendors, like, by the way, we're dealing with this. We're not talking about anything else. And they were all very understanding. But then after the midway point, so after I had my PET scan and, the oncologist told me that I was in complete remission, I still had the 3 cycles left. And that's when, yes, the wedding planning came. And ironically, after that scan is when I started to get more anxiety, because it was kind of like the last few months, we've been in this bubble of like, we don't have to worry about anything other than me, like, literally surviving, living. So, I had that routine, wake up, go to work in my house, and then, maybe have a doctor's appointment, have dinner, go to sleep. That was the routine. Or, go to the hospital because you have treatment. That was it. So that halfway point, and my doctor said, you can start to plan, I'm comfortable with you moving forward with your wedding. And I said, it's in April. She said, yes, that's fine. Should be good. And I said, it's almost 200 people, or more than 200 people we're inviting. She says, that should be fine. All these things, germs, everything. So she gave us the okay, and I said, okay. And that's when it all started to sink in. I do remember one night in particular, I could not sleep. And I think that was when, I was naive for a while with the hair because I had a few nurses tell me, like, they had seen some patients not lose all of it. So I hadn't shaved my head or even cut it at that point. I just basically looked like Gollum from Lord of the Rings. Like, it was bad. I should have cut it a lot earlier. But that was an area where, like I've been saying, my family, we joke about things, but they knew I could joke about my hair, but no one else could. I would punch someone in the face if they said anything. Obviously, everyone's hair is different. So, constant Googling of how fast you can grow your hair safely, what you could take. So that one night, I could not could not go to sleep. I tried some of the anti-anxiety medications that, they send you home with, and that didn't help. I think it made me worse. I was like, okay, there's a reason why I haven't been taking these. So, and I remember that morning, again, my fiance and I, we were in the same town, but different houses. And I just remember texting him saying, like, today is not a good day. He was like, do you want me to just come over, like, and sit with you? And I said, no, not, there's nothing to do. But I think it was the reality of, like, okay, now you have a home to fill because you don't have furniture right now. Oh, I was also renovating a kitchen, or I was about to renovate a kitchen, or dreaming up the plans for that. So it was like, okay, life is going to start again, and it's gonna be fast because I'm gonna be done in November, God willing, and if all looks good, I'm gonna get married in April. And it was like the freight train was just pushing past anything that was blockading it, and we were full steam ahead. So that's why I think April was the true finish line in that sense. So I think mid-December, because right before Christmas was my results for that. But she said, I don't want to see you until June, and you're going to be married, and, you're going to be whole. And I was like, okay. And I wasn't sure if she did that because I guess, 3 months would be around like March if I were to do that. And maybe she didn't want to ruin anything. But that's what I just think. But I don't think so. Because now my checkups are every 6 months, I'm sorry. And I don't even do PET scans anymore. I just do CT scans. So that's to me, that's promising too, just because you don't have to do the more detailed scan, so she's not as worried about anything. Yep, complete remission, and everything so far. And that's where I think, yes, I think I definitely have scanxiety, and mostly because of what we're finding more now afterwards. And I had mentioned that I was getting migraines, and they definitely were more pronounced after chemo. And I thought that was because coming off of a lot of bad drugs, right? And I noticed they were tension headaches, and there were certain situations where I would get them, in that June scan, I was clear of cancer, good on that front. But she did mention that I had something called Chiari malformation, which is something that could cause the headaches that I was getting. So, she recommended me to go to a neurologist, which has been something that I've been on a journey, a new journey with learning a new topic on the health area itself. What I've learned, you're born with it. You might not have any symptoms, but for me, again, I'm pretty asymptomatic for it, given how severe it has become, where it's caused some issues. It's caused what's called a syrinx in my spinal cord, which is what I'm recovering from now, from that surgery, to fix it. But definitely something that you kind of look back and say, yes, I had cancer, but if I didn't have cancer, I would have never probably mentioned my migraines or tension headaches, or, I thought they were really normal. Also being an advocate, people do tell you, like, oh, well, you're a woman between the ages of 25 and 50, which is a very broad age range, by the way. So it's pretty common for you to have migraines. Like, you just named half the world population. So we're all supposed to have migraines. So if I had stuck with that, I'd probably, have not gotten the surgery, because I'd say, oh, I'm just a woman who gets migraines. But being very detailed with what you're experiencing, I'm learning now. I went to the doctor yearly, for yearly checkups up until I was 28 years old. And now now I'm like, oh, well, my left pinky, I'm not trying to over diagnose myself, but now I'm realizing I think I'm onto something when I have some of these issues. In my IVF journey, someone dropped, a term that they said, oh, by the way, did you know this? And I said, no, I didn't, because women's health is so undiscovered. And I said, no. So I wrote it down and I said, the doctor had said, not something you need to address today, but maybe something that you might want to address in the future or know about. So I wrote it down and I said, I'll come back to this one day. But, I read my scans and the reports afterwards. I'm lucky enough where I have a radiologist in the family who I could text her at any point and say, what is this? What is that? And she'll say, oh, that's nothing. But even with the Chiari, she had said, I have Chiari too. And I said, okay, that's good. But, utilize the resources that you have, or, the people around you, because unfortunately everybody has an experience with cancer. And, I'm not the first, and I'm certainly, unfortunately, not going to be the last. But everybody has, an experience or a trick or something to do. Like, I knew walking was my thing for treatments and staying whole in that point. But I would say for anybody who's going through anything, whether it's a cancer journey or, seeing an individual go through it yourself, there are definitely dark times in there, but after every storm, the sun does come out and shine. So I think just trying to keep your head up in those times is helpful, no matter how hard it is.